Good afternoon, everybody. I'm Muriel Bowser. I am here to provide you an update on Washington, D.C.'s response to COVID-19. I am joined by members of my administration, Councilmember Phil Mendelson, Councilmember Kenyon McDuffie, representing the Council of the District of Columbia, members of our faith community, education leaders, and nonprofit leaders. Let me start by saying earlier today, we announced that starting this Monday, March 16 through Tuesday, March 31st, D.C. government will operate under an agency-specific telework schedule with an intent to deliver critical services to keep our systems and our government operating. Some operations will be performed fully remotely, while others will continue to be performed at public buildings, but under modified operations. We also announced this morning changes to our DCPS and public charter school schedule, and that schedule change will also begin on March the 16th through March the 31st. We are also encouraging child care facilities to follow this schedule and plan to reopen on April 1. The Deputy Mayor for Education and the Office of the State Superintendent for Education are also working to identify facilities to be open, child care facilities that is, for the dependents of essential personnel. We have announced that meal sites will be open for students as well as for seniors across the district during this public health emergency. DPR recreation centers and DC public libraries will also close on March the 16th and reopen on April 1. Additionally, DC Health has updated its recommendation against mass gatherings of 1,000 individuals. That upgrade is DOH is requiring a ban on mass gatherings and lowered the definition of a mass gathering to 250 individuals. There will be some exceptions, and you just follow the DOH guidance. Let me also continue by talking about how we will fund our preparations and the execution of our emergency response. Already, I have directed $7.5 million from the district's contingency cash reserve fund to purchase needed supplies, protective equipment, and other necessary equipment. And we will continue to make these types of investments. I know that residents have additional questions about testing, so let me share some of the high-level facts. To be clear, doctors decide on COVID-19 testing. If an individual is experiencing symptoms, including cough, fever, and shortness of breath, they should consult their doctor before visiting any healthcare facility. If their doctor decides that COVID-19 testing is warranted, the doctor has the ability to take swabs and send them to a private lab for testing. The private lab will share results with the doctor, who will share the results with the individual. The private lab will also alert DC Health of all COVID-19 test results, regardless of if the test is positive or negative. If there are more questions about testing, you may address them to Dr. Nesbitt and Dr. Smith. I want to finish by saying how proud I am of all of our DC government employees. This morning, I conducted an all-DC government conference call to talk about our modified operations. I'm proud of my administration and managers who are stepping up to the plate to make sure that we can adjust our operations during these unprecedented times. I'm also very grateful for the cooperation of the Council of the District of Columbia. We have been participating in weekly briefings with the Council and working together on a relief package for our businesses and residents. And I look forward to introducing Chairman Mendelson in just a moment. Let me also continue to remind you to keep checking coronavirus.dc.gov, coronavirus.dc.gov for up-to-date information and guidance. So with that, I first want to turn to our schools And I want to invite Deputy Mayor Paul Kine to just come up for brief introductory remarks. And he may also acknowledge any public charter school leaders we have here and introduce our Chancellor of DCPS Public Schools.
Thank you very much, Mayor Bowser. As the mayor said, we have announced that starting on Monday, the 16th of March, going through the end of the month, we have moved towards a system where our schools will not have students in them, but we will have remote learning opportunities for all our children. And let's be clear, we're doing this to ensure the safety of our children and of the staff within our schools. And it is important that families understand that because children are not in school and their students are not in school, they should also not be congregating elsewhere. We are doing this to encourage the social distancing that is imperative as part of our mitigation strategies. DCPS schools, in close cooperation and collaboration with the Public Charter School Board and all of our charter LEAs, are shifting to this distance learning posture. And my office and the Charter School Board, as well as the DCPS Central Administration, are working now tirelessly to provide resources to schools to ensure that their distance learning activities will be successful and that learning will continue for students. We are joined here today by Chancellor Louis Farabee, and he will now share a few remarks about what DCPS is doing specifically to ensure the continuation of services for students during this time.
Thank you, Mayor. Thank you, Deputy Mayor. At this time, DC Public Schools has communicated to our employees our plan for their modified work assignments for the time period that we will not have students in our building for school. It's important to note that beginning Monday, March 16th, we'll have no school for students until March 31st. On the 16th, we'll continue with our professional development day that has been planned for staff, which will include staff preparing for remote learning, but also assigning devices to teachers that currently don't have devices at home so they can continue the learning process with students. As it relates to the remote learning process, students will have access and families will have access to a website which will include grade level content and content areas, for example, for English language arts, mathematics, and at the high school level, it will include all of our courses required for graduation. Students will have the ability to receive assignments, submit assignments, and also receive feedback on their assignments. And educators will also host office hours in which students can communicate with educators, and also educators can communicate with families as well. During the period where students are out of school, we've communicated also that there will be meals provided to students. We've identified sites for our families across the district. We'll include that would be for all students in the district, and we've added additional sites to ensure that we touch all of our students that may need access to meals while we're out of school. Thank you.
Thank you. Thank you to our public education team. I also want to ask the city administrator for the district, Rashad Young, to come up to update us on the district's teleworking process.
Thank you, Mayor. This morning, we sent guidance to all of our agencies around our telework posture. Approximately 53% of the district workforce will be teleworking beginning next week. We have contingency plans and operational plans in place to try to limit the amount of public interaction that is required for our agencies that have to maintain an operational posture. Some agencies will have 100% telework. Other agencies will be adopting a modified telework schedule, which means some of their employees will have to come in because they perform essential services. Others will be able to telework. And some of our agencies, primarily our public safety agencies and public works-related agencies, will not telework because all of their employees are deemed essential. We've sent that guidance to our agencies this morning. Agency directors are further speaking to their specific work units and employees today to specifically talk about their operational posture if they are to telework or if they have to come into a public facility to maintain critical operations. We will update our telework guidance as appropriate, but we expect those employees to begin that new telework duty beginning on Monday, March the 16th.
I also want to acknowledge Dr. LaQuandra Nesbitt, also Dr. Chris Rodriguez, who is the director of the district's HCMA. We are in a building that is also very close to the Department of Health's headquarters and their emergency operations center that has been stood up by HCMA. If this is likely a room that we will use for other briefings as necessary. So I want to ask Dr. Nesbitt to come give us an update on updated DOH orders, and she will be followed by Dr. Jennifer Smith to talk about our public health lab.
Thank you, Madam Mayor. Today we have gone through the process of establishing emergency rules to proceed through the process regarding mass gatherings. Earlier this week, we made a recommendation that all mass gatherings that were non-essential in the district, including conferences and conventions, would be canceled or postponed. Today, we are establishing emergency rules that calls for a ban on all mass gatherings of 250 or more individuals, and for individuals that for gatherings that are intended for individuals who are part of at-risk populations, that those gatherings would not have more than 10 individuals. These strategies are being put in place as part of our social distancing measures that are part of community mitigation, as Deputy Mayor Kine has mentioned before. It is critically important that individuals recognize, as we implement teleworking policies, as we have school closures in the district, that these are not intended for individuals to not be at work or not be at school, but to congregate in large groups in different places throughout the city. So as we have our mass gatherings ban in the district, we seriously want people to not host events that would have people congregating, increasing opportunities for the transmission of coronavirus. This mass gathering policy does not apply to schools, workplaces, or healthcare facilities, or residential buildings. So that's some of the things that we want people to understand. And we will have these regulations published in the D.C. Register for further review.
Dr. Smith.
Good afternoon. I'm Dr. Jennifer Smith from the Department of Forensic Sciences, the Public Health Laboratory. To date, as of this time, we have not gathered any more or tested any more positive cases, so we still remained at 10 positive cases. We have done additional testing. We now have 49 negative cases, and we have 10 cases that are pending. So we have a total of 69. We will begin to post these results, and we will also obtain from DC Health any additional results that are coming from outside labs, and those will be done throughout the day and posted by the end of the day.
I'd like now to introduce Council Chairman Phil Mendelson. We just wrapped with a meeting with members of the council and our budget teams to talk about what we've heard from our communities in terms of the relief that would be needed. We recognize that the containment measures that we're putting in place are having a very significant impact on our economy, on our nonprofits, on our churches, and on our restaurants and hotels and our business community at large. And so I want to introduce Council Chairman Mendelson to represent the council.
Thank you, Mayor Bowser, and good afternoon to everyone. The council has a scheduled committee of the whole meeting next Tuesday, and we will have an additional legislative meeting at that time. And at that meeting, we will have a bill. It's called an emergency bill because it goes into effect immediately without congressional review, and it is also in effect for 90 days. And it will address proposals to mitigate the consequences of this pandemic. As so far we have identified proposals. It also will expressly authorize that this public health emergency can remain in place for 45 days, so the mayor will not need to come back to the council for any extension of time within that 45 days. As the mayor indicated, the executive, meaning the mayor and her senior staff and the council, have been working together. In fact, the meeting we had this afternoon included the chief financial officer as well, as we were working through different proposals. We are looking at what kind of relief we can provide to businesses. We're looking at tax deferrals, which are in essence an interest-free loan to businesses so that they do not have liquidity problems within the next couple of months. We are also looking at measures that will provide some relief to individuals, and in particular, we're looking at where there are license renewals. For instance, individuals who need to renew their participation to the Healthcare Alliance, that there will be a tolling. I think that's what we're looking at, a tolling or extension of time, so folks don't have to think about how they have to get in line and with a whole lot of other folks and worry about the renewals. We're looking at this as broadly as we can. There also will be provisions, the mayor and I and others talked about this afternoon, to ensure that evictions are not actually carried out during this public health emergency or utility disconnections. So those are some of the proposals that we are looking at. A draft of the bill was circulated yesterday and is available on the council's website. It is being revised, and there are some provisions that are being added to it. I don't know whether we will be posting it again before Monday, but we will be trying to make sure it's available to the public before the meeting on Tuesday. Thank you.
Thank you.
And I neglected to note that Kenya McDuffie, the chair pro tem and council member from Ward 5, is here as well. Thank you.
I also want to acknowledge and thank Rosie Allen Herring for being here, who is the CEO of the United Way. We gave Rosie a call because we had heard from another number of church communities, nonprofits, who are going to be hard hit during this time as well. I note that a number of our faith congregations have heeded DOH's advisory and have canceled services. Some of them will work with the United Way for their parishioners and their congregants who want to continue to be active with them. So thank you, Rosie, for making your service available. Okay, so with that, we will take on-topic questions. Yes, Sam.
Mayor, it seems then basically, except for those three agencies that you mentioned, there really will be no face-to-face contact between D.C. government employees and the public. Is that essentially
I didn't
it?
mention three agencies.
You talked about the police, the fire, and DPW, as I recall.
Oh, no, there are a number of agencies and parts of agencies where employees will continue to report to work.
Bowser.
I don't have it off the top of my head, but we can provide you with that. So where it is, Sam, is that we have three categories. There are some agencies that we think can very nearly 100% telework. Others that portions of their workforce can telework and others cannot. Those are the kind of the modified telework group. And then there are agencies who are not eligible for telework. I think those must be the agencies you just referred to.
Talking about
Yes.
it. What about, for example, license renewals? I heard the chairman mention that, like DMV, places like that. Because let's say your tag expires.
Right, and so what we're working on right now is for each of the agencies, and I'll ask the CA to come up and answer more specific questions. We'll be noting on their websites how their operations have changed. So we're asking people before they even try to go to call or look on the website so you know exactly how your operations have changed. Where possible, if there are due dates during these emergencies, we'll try to extend them where possible. It may not always be possible, and frankly, we're still looking through that. So we need people, if they have business with the district that has a due date, to make sure they're calling ahead, checking the website, so that we can give you the correct response.
Mayor Bowser,
Yes.
is the ban on mass gatherings now mandatory?
It is.
So are there penalties, or how is that enforced?
Let me ask Dr. Nesbitt to come up. It did require us to promulgate a rule.
So during an emergency or public health emergency, there can be penalties associated for violation of any of the orders that are deemed necessary to protect the public's health and to ensure that order is restored.
Yes.
When you say no more than 10 people from at-risk populations, what's considered an at-risk population?
Individuals over 60, individuals with chronic medical conditions, and individuals who are considered to be immunocompromised.
How does that affect senior centers?
So we have been working very closely with our organizations who provide services to seniors in our Department of Aging and Community Living to suspend and recess their senior activities during this time without the compromise of feeding programs.
Yes.
For you, Ms. Mayor,
Yes.
are the daycare facilities and the daycare centers run by the city closing?
Well, the city doesn't run any daycare centers at this stage. We have some daycare centers in our buildings, but they're run by private operators. And we are recommending that at large that daycare centers also close following what we've decided for DC Public Schools. However, and there's a big however. The big however is I've asked the deputy mayor in OSSI to come up with a program to recruit providers who will stay open during this time, especially around our hospital sites for our employees and not just our employees, but employees that cannot telework and have to be at work to do their jobs. So our employees that have been mentioned, but also all the medical staff that are keeping our hospitals running. So that information will be updated. We are working on it and we need to identify how many slots we really need, what the demand is, and how we can help providers think through it. Yes.
So every doctor in the city will have the ability to send swabs to a private lab. Is that how this is going to work? And then also, is this information going to be on the government website once you have all of the results from private labs? And how many are there?
Yes, let me ask Dr. Nesbitt or Dr. Smith to address that.
So currently, and this is evolving, there are a lot of announcements of labs coming online, but we know of at least 2 major laboratories that are accepting samples right now. We are going to track those results. They do have to be provided to DC Health, and we will be tracking and compiling those throughout the day and posting those in the evenings.
And I think many of you heard the president's announcement a little bit earlier. We don't know any more than you know at this stage about the more testing that the federal government will be rolling out at retail locations. He said that we would get more information about that in the coming days. Yes. Oh, you've asked. Let me get somebody else, Sam. I'll come back to you. Yes.
For daycares, will parents who receive vouchers, will those vouchers continue to pay for daycares, and daycares that are receiving subsidies, will those subsidies continue to trickle in? And would you, if daycares want to remain open, would you use your quarantine powers or whatever powers you have to ensure that they don't stay open?
As I said earlier, Perry, we recognize that we still need daycares to function, some of them, not all of them. And so we are working on the slots that we think we need. Not only will we allow them to stay open, we're going to encourage them to stay open.
And for the subsidies?
I think that, yes. Yes, the subsidy will continue.
And for Chancellor Farabee, you mentioned that kids would receive, an online website. What if students do not have access to that website? I understand while a lot of kids have access to internet, many don't have enough reliable internet to go as far as submitting kind of paperwork and things like that.
Thank you, Perry, for that question. So beginning next week, families and students will have access to their schools to come pick up hard materials. So if they want a hard copy of the learning package or tasks associated with the distance learning period, they can come to the schools. We will share with families the times that they can come and receive those materials. It's also important to note that many of our students left their campuses today with their consumable materials, their textbooks, any other literature that they would need during this time period to support learning. And so with those materials that they left with today, coupled with what will be posted online and what families can pick up at schools, we believe that provides adequate resources for students to continue learning.
Will teachers be checking in with students?
Yes, teachers will be checking in with students. Once our teachers have had opportunity to have time with the site and the materials, we will then make that available to the public, which will be organized by grade level and by content area.
But they'll be calling students during the, I know some charters mentioned this, I don't know if that's a plan.
Yeah, so we will post office hours for each school. So each school has a communication channel in which they will communicate to their families of how to contact educators. And with the office hours, we provided technology solutions for our educators to communicate directly with students.
Mark.
So, and I don't mean to be smart ass about this question, but you're talking about social distancing, you're talking about banning groups. Does this meeting, do these press conferences comport to best practices? I'm guessing that, I mean, there's a lot of non-essential people in this room right now who don't need to be here. I'm betting I can count 10 people over 60 in this room, and I'm just wondering if we are practicing best practices.
Actually, we thought about that. So we're practicing one best practice because ideally I would like to be having this press conference in the Emergency Operations Center. We decided not to let you in our Emergency Operations Center in case you infect any of our essential personnel. Some of them are here. And that's a serious issue because something like that could wipe out our whole public emergency response. And so you ask a serious question. I have asked my team to think of alternate ways that if we needed to clear the press room, we could still make our statements and you could still ask your questions. So that is in development. Yes.
I was talking to charter school today, I guess for Dr. Farabee. I was talking to charter school today. They were saying that next week is spring break, and then the following week they begin learning. Is that how it works with DCPS? Or?
Yeah, so what you're describing is the DCPS plan. So beginning on Tuesday, March 17th, we will go into our spring break period, which was previously in April. After the 5-day break for spring break, the following Tuesday, we'll begin the distance learning process. And part of that is to ensure that our educators have ample time and preparation for the distance learning period, and also to ensure that we have communicated with all of our students and families so they're clear around what to expect during that time period.
So the second week really is when school actually starts. The first week is a break.
That is when the remote learning would start, correct.
And then in terms of food for young people,
that begins next week.
And how do people find out about that?
So we've made that information available through our website, through social media, news releases. We're asking everyone to share that information. It's important to note that there is a large window of time period on the site selected. So it begins at 10 a.m. And concludes at 2 p.m. And it is something that we'll modify or adjust should we need to do so based on the experiences that we'll have next week.
Let me just add to that. I want to thank, I think you were at Friendship earlier. I want to thank Friendship and the KIPP DC, who we spent a lot of time consulting with. They're our largest charter operators, and it was important to us that we sent a one government message around what we need to do with schools. So I want to thank them for that. Yes.
Mm-hmm. I was talking with Washington Legal Clinic for the Homeless, and they were curious about when hand washing stations are going to be up and near populated encampments. I'm thinking of like the Noma encampment. Then also I'm wondering if regular cleanups at encampment sites that I understand happen throughout the city Tuesdays and Thursdays are going to continue. I know workers have expressed concern over like it kind of goes against social distancing because groups of people are gathering and cleaning all the encampment sites. So I wonder if there's any kind of planning on that.
We'll give you an update on that. But we have, as you know, outreach teams that are constantly out with our residents who are experiencing homelessness that are unhoused or unsheltered, and they have a supply of hand sanitation that they will continue to distribute.
And the hand washing stations?
Well, I'll have to get back to you. I know our program right now is hand sanitizer.
Okay.
Yes.
I got questions on testing. Can someone explain what the change is with the policy surrounding testing with commercial labs? Because I think I've heard from some people that they needed some sort of code from Department of Health in order to refer a sample to a private lab. Is that changing, or what's new here?
Okay. LaQuandra?
You do not need to go through the Department of Health to use a commercial laboratory.
And is that the case starting today, or?
That has always been the case.
So then what's new with commercial?
You have never needed a code from the Department of Health to go through a commercial laboratory.
And is DC Health going to be revisiting its testing guidelines now that we have person-to-person transmission?
Our guidelines are intended for anyone who wants to have their test processed through the public health laboratory.
Will you?
Our guidelines are intended for anyone who intends to have their testing processed through the public health laboratory.
But does that change?
We are not revisiting them at this time.
At what point does that change, though? Does that change when we have significant community transmission? Or?
We do not intend to revisit our guidelines at this point.
Doesn't have anything to do with a person's access to a test. They get it from their doctor.
What's our testing capacity by day now? Because last week we were told that it was going to be in the 80s by this week.
We test 10 to 15 patients per day.
And what's the overall capacity?
That's the capacity. It's 10 to 15 patients per day.
We were told last week that it was 50. So what happened?
You want to explain that?
Sure. Yeah. So part of the issue is how many individuals. Right now, there is a manual extraction process that's being used. We are waiting the arrival of robotic equipment that can enhance our capacity to do that testing.
Yes, Perry.
Did I hear you correct that every single LEA is following DCPS's schedule?
Yes, Perry, thanks for the question. So we have worked extremely collaboratively with the charter LEAs, and in fact, we've spent the last day on the phone with every single charter leader in the city, sharing with them our thoughts about what the mayor's desire was in terms of schools, and we have received outstanding cooperation from them. And as far as I'm aware, all of the charter LEAs will be following the March 16th to March 31st closure with distance learning.
Any thought to restricting visitors to senior centers, retirement homes, hospitals?
We are looking at all of our vulnerable populations, and we'll likely have updated guidance on that. We don't have anything to report right now.
And then have you done anything as far as activating or putting on standby the National Guard?
My emergency power allows me to call them up, but I'm going to have Chris address that.
So in the Emergency Operations Center, we do have National Guard representation, and they are standing by if any resources were requested by the mayor.
And so just so I can clarify, because I was told just the other day by someone in your staff that the mayor didn't have the authority to call out the National Guard, but are you saying that because the state of emergency has been implemented that has changed?
The mayor has the authority to call up the National Guard.
Okay.
Yes.
Does the ban on mass gatherings include restaurants that have more than 250 people, that can seat more than 250?
If they're in a mass gathering.
Well, yes.
Does that count as a mass gathering?
If a restaurant, does a restaurant count as a mass gathering?
Yes.
Yes.
Another question on testing. Right, you're seeing folks take to Twitter and also take to the media about like long wait times on the phone, speaking with providers. They're describing having to wait and then being denied by their provider. I wonder if you can just kind of respond to that.
Well, and I'm going to turn to Dr. Nesbitt to respond to that, but we're in an unprecedented pandemic, and I think that everybody has to recognize that all systems are strained, including our healthcare professionals, call centers, and the like. And I think the medical professionals are doing their very best to let people know, based on their symptoms and their history, what's required for them. And I think there's some frustration in that, but we support the science and the medical recommendations. Okay, a couple more. Yep.
What are you looking for from the federal government?
Oh, that's a big one. So we are, I will, of course, and I have to be honest with you, I haven't had a chance to really review what's on the table from the Congress. We have heard loud and clear that it's really going to be the federal government that can push out more testing and make sure that more tests are available around the country. I think that's pretty clear. So we need that. We also need relief for an economy that is, we don't know what's going to happen with the economy, but we know that we're going to get a strain. We're basically stopping visitation and tourism. And tourism employs a lot of D.C. residents, a lot of DMV residents, so they're going to take a hit. Some of our big parts of our economy, our hotels and restaurants, they're going to take a hit. But the people who work there are taking hits as well. So any type of relief will be helpful. For those people, we think that we have what we need from the feds regarding unemployment or people who are going to be losing hours as a result of this, being able to claim unemployment. But certainly anything that they could do around paid sick leave for people who have been affected by COVID-19 would be very important. There's probably 1,000 other things that I'm not mentioning right now, but we will review what's in front of the Congress and the things that we can do locally, that we can sustain locally, we're certainly going to do in cooperation with the council.
Last question.
Yes.
Yeah, so will these daycares that you're going to be opening up, will they be costing money? And how are you guys going to keep teenagers and other, students from congregating, together?
So here's the deal. If we want to have containment of this virus, we and other major cities have got to be committed to keeping people and restricting their movements. And people have to exercise social distancing. And part of the debate among many of us and among the scientists is closing schools going to accomplish that. And that is an unsettled point. So that is why you heard Deputy Mayor Kine and Dr. Nesbitt say the purpose of having distance learning is to be at home, distance learning. It is not to be out in big groups, because if you're doing that, then you're contributing to the problem. For our workforce, telework is work. You're to be at home and available and doing your work and social distancing at the same time. That's why we've seen quite a lot of this closures around the city. Now, I will say our team is trying to think of ways during the channels that we have, like during our public channels, to engage people. We are very concerned about isolation and loneliness among a lot of individuals, especially our seniors. We are concerned about idleness among our teenagers. And so we hope that our families are thinking of ways to keep young people engaged and involved.
Thank you, everyone. Can we get an update on the 3 cases with unknown causes? Have we made any progress there?
Okay, this is your last question, and you also wanted to update.
So I'll give you an update on the 3 cases that we previously reported that did not have a known exposure. 2, we are still doing the contact investigation to try to identify a known exposure. And 1, the index case for Christchurch, we have tentatively identified a connection to other cases outside of the District of Columbia, possibly related to a conference in another state.
The Kentucky conference?
Yes. As it relates to the mass gatherings, We have, on the night that we introduced the initial one, we were able to have a call with the cultural institutions and have a lot of guidance to them in terms of the interpretation of mass gatherings. In particular, many members from the Restaurant Association were present. We gave them a lot of detailed guidance. Restaurants are not necessarily intended to be part of the mass gatherings piece. We do have some restaurants, however, that have banquet halls attached to them. We have given them guidance that the banquet hall part of their venue should not be used for large gatherings. But the traditional dining space, the science tells us that that space, when used for small groups, is still appropriate for day-to-day operations. We also have been able to give guidance in terms to movie theaters and cinemas and movieplexes, is that the theater that has less than 250 seats, less than 250 people, is still appropriate for day-to-day operations. So I want to make sure that's correct. Wanted to make sure that that was clear. And that is explicitly outlined in our rulemaking.
All right, thank you.